How are they ventilating? Is it a conscious sedation? And what is that coming out of the oropharyngeal airway? I've never seen a patient undergo a procedure like this without an endotracheal tube. There's a lot of good questions and a lot of confused questions in there. Conscious sedation means the patient's conscious and they're sedated, so they're breathing on their own. So you don't need an endotracheal tube if you're breathing on your own. So our patients are undergoing IV sedation, which is intravenous sedation. They're not conscious where they're reacting to everything that I'm doing, but they're conscious enough to be breathing on their own. So the oral airway that you see in these patients is just to keep their mouth open so they can breathe better, because when you fall asleep, some people, they snore. We don't want people snoring because it kind of moves your face. So the oral airway, all it does is keep your mouth open and keep your tongue out from the back of your throat. Then we also place oxygen. Oxygen can be placed through the nose, or since the patient's breathing through the mouth, we place little tubes of oxygen in there. That's all it is in these patients. A general anesthesia requires an endotracheal tube. So my patients, you will see, for what I do, I don't do any of these cases under general, but you will see an oral airway in them. You'll see them breathing on their own, but you'll see them comfortably asleep.